is not for profit.
Let's stop it. Our health is not for profit. Let's stop it. Our health is not for profit.
Woo!
Everybody in.
Nobody out.
Everybody in.
Nobody out.
Everybody in.
Nobody out.
Everybody in.
Nobody out. Nobody out. Nobody out. Nobody out. Nobody out. Woo! Amazing. Hi, good morning.
When do we want it?
Now! Medicare for all! Now! 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 Medicare for all! Now!
What do we want?
Medicare for all!
When do we want it?
Now!
What do we want? Medicare for all. When do we want it?
Now!
What do we want? Medicare for all. And when do we want it? Now. What do we want? Medicare for all. And when do we want it?
Now!
What do we want? Medicare for all. And when do we want it?
Now!
Hey, hey! Oh, oh!
Wiser model has got to go!
Hey, hey!
Ho ho! Wiser model has got to go!
Hey, hey! Ho, ho! Wiser model has got to go! Hey, hey!
Ho ho! Wiser model has got to go!
Wiser model has got to go! Hey, hey! Ho, ho! Wiser model has got to go! Hey, hey! Slow down.
Let folks catch up.
Amazing. Hey Morgan, what does healthcare cuts do?
Yes. Yeah.
Woo!
Get up!
Okay.
Get down! There's a healthcare movement in this town! Get up! Get down! There's a healthcare movement in this town! Get up! Get down! There's a healthcare movement in this town! Get up! Get down! There's a healthcare movement in this town! Get up! Get down! There's a healthcare movement
Right,
in
not
this
politically.
town! Get up! There's a healthcare movement in this town! Get up! Get down! There's a healthcare movement in this town!
Ranches.
Be careful, be careful.
All right, welcome to Area 11, y'all.
Stand up, fight back. Stand up, fight back. Stand up, fight back.
To the tree. Let's go to the tree. To the left.
pediatrician in Maryland. Good morning, everyone.
Good morning.
We are here today to remember the thousands of lost souls every year to America's healthcare system where profits matter more than patients.
Shame!
We are here to fight for the souls of our clinics and hospitals threatened by the big but ugly bill. A bill that threatens and wrecks everyone's healthcare just so a few billionaires can get wealth care. We are here to fight for our own souls as physicians and healers. For far too long, insurance company greed machines and big pharma corporations have undermined our integrity.
Shame!
Our work is for patients, not profits. That's right. We are here to serve patients. This system, let's stop it.
Our health is not for profit. This system, let's stop it. Our healthcare is not for profit. This system, let's stop it. Our health is not for profit.
We do not serve private equity firms and vulture capitalists. Enough is enough.
Enough is enough.
We do not want to be part of the business plan of the insurance companies. Enough is enough.
Enough is enough.
We do not want to be part of Medicare Advantage or this Wiser program from Dr. Oz and RFK Jr. We do not want AI bots in Medicare telling us how to do our jobs. Enough is enough.
Enough is enough.
Serving patients is hard work, but it is harder on our hearts and souls in this system. But together, if we can fight even half as hard as we work, we can do better for our patients.
We can do
When we fight,
We can build Medicare for all. We will build Medicare for all. What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
That's right.
when we fight,
We win.
we win. When
I
we
wanna
fight.
I want to thank this rally's co-sponsors for joining us in this fight. Thank you to Social Security Works, National Nurses United, Popular Democracy, People's Action, the National Alliance for Retiree Healthcare, the Labor Campaign for Single Payer, Healthcare Now, the Cross-Union Retirees Organizing Committee, SEIU's Committee for Interns and Residents, Progressive Maryland, and Be a Hero. I am honored to introduce my sister-in-arms, PNHP President. You know her, you love her, Dr. Dojeet Singh.
Hey, everybody.
Woo!
Can you guys hear me?
Yes.
So I am a practicing physician. I'm a practicing gynecologic oncologist. And we are here in D.C. because our elected officials are failing us. They are giving our taxpayer dollars to their billionaire friends, and they are destroying healthcare.
They can't hear you in the back. Try to use the mic.
Oh, I think I'm using the mic.
No.
Be right up against your mouth.
Get off.
Oh, Bert. I was very
Yeah.
Wait, you guys couldn't hear me?
Right up to your mouth.
Not in the
You
back.
guys couldn't
There.
hear me?
There we go.
There you go.
We can.
Yeah.
Get it right up to
Yeah.
I like this mic.
Louder than you
Closer
think.
to your
Louder
mouth.
than you think.
Higher.
So, no one here voted to cut Medicaid. No one here voted to shut down community hospitals.
No.
No one voted for skyrocketing premiums.
No.
The people don't want this.
No.
Doctors don't want this.
No.
When Medicaid is under attack, what do we do?
Stand up, fight back.
When Medicaid is under attack, what do we do?
Rise up, fight back.
Doctors across the country are outraged by this harmful bill that Congress passed. You know, trillions of healthcare dollars and healthcare cuts are going to hurt patients. They're going to take apart our public health programs and force doctors out of practice. Rise up!
Fight back.
This system, let's stop it.
Our health is not for profit.
This system,
Let's stop it. Our health is not for profit.
So that's why we're in to hear our message. We need improved Medicare for all. What does that mean? Universal coverage. No prior auth, no co-pays, no deductibles, no going into debt. What do we want?
Medicare for all.
When do we want it?
Now.
We are hundreds gathered here today. Medical students, doctors, nurses, residents, union members, seniors. We are everyone. We are fighting for everyone in America. We're fed up with corporate-controlled health care, and we are growing. This is how we will win the health care we deserve. We imagine, we can see a system where everyone is covered. No one is denied the care they deserve. Doctors are not spending their time begging greedy insurance companies to just get their patients the things they need. Let's make our politicians understand now is the time for universal health care, free from profit, free from co-pays, free from deductibles, free from prior auth, and free from the threat of medical debt. Health care, no strings attached. Single payer is where it's at.
Healthcare, no strings attached. Single payer is where it's at.
Thank you, everyone who is here today. Thank you for the work you're going to do today while you meet with your elected officials. Thank you for spreading the message. Thank you for doing everything you can to care for our patients. Together, we can transfer the healthcare. We can transform the healthcare system. Organize! It is my honor and pleasure to present somebody who is going to share his story with us. This is Danny Manny, part of Progressive Maryland. Thank you, Danny. No, you don't have to touch anything.
Thank you, everyone.
She can hear
To do
it.
something.
Go. Give it to her.
Sound issue.
Thank you, everyone. I appreciate it. Hello, I go by Danny Manny. I reside in Maryland. I have intellectual disabilities because of diabetes. My developmental delays make it difficult, but with the support of the home-based waiver Medicaid program, I am making progress every day on my job skills and independent skills. When I was a kid, I could not talk for many years, but through therapy and lots of practice and help from my family, I've gained communication skills. Now I can even do public speaking like this. I used to feel locked up and isolated when I was in an institution and trapped when I was in a group home. This was before the pandemic, actually. Now that I am able to be in the Medicaid home-based program, I have more freedom and a better chance to make progress. I can volunteer at community events. It helps me feel connected. I like helping out, including at home with a dog we rescued 5 months ago. I do best in my current setting. I would not have the opportunity in a different place. I am afraid that this budget is set back and that people like me who could help society and reside with dignity could be forced back into residential homes and institutions.
That is right.
If anything, Medicaid needs more funding. I have a nurse who helps me manage my diabetes, but I had to wait 24 months to get assigned one. The behaviorists are also booked. This causes safety issues for some more vulnerable patients and their families. My biggest concern of all with this new federal budget is cuts to Medicaid for over 18,000 people on the waiver programs in Maryland, including the home-based waiver. My family has friends who have been dropped for no reason except mistakes with paperwork. These changes and cuts to Medicaid will mean that the staff who process this paperwork will get reduced even further, making the approval process take even longer because of higher caseloads for the determination staff. About 1.7 million people in this country rely on these home-based programs, just like me. When healthcare is cut, people are injured.
When Medicaid is under attack, what do we do? Stand up, fight back.
I'm going to keep fighting to make sure our elected officials hear and understand that enough is enough. They must take our families to priority. They need to restore the funding and protect their health care. That is why I am here today and why I've been sharing my story with elected officials this year. Thanks so much.
Danny!
it to Mo.
Thank you for the work you are doing.
Thank you.
We have so many amazing allies. We also have today Julia Truelove from NNU, National Nurses United. One of the powerful groups also fighting for universal health care in America. Julia.
Good morning, everybody. It's so great to be here with you all today. My name is Julia Truelove. I'm an ICU nurse at MedStar Washington Hospital Center, right up the road, and a member of National Nurses United.
Keep the mic up. Keep the mic
Thank
up.
you to Physicians for a National Health Plan for bringing us together in such a critical moment. While I have you guys here, Mr. Smith in 12 still needs that Tylenol order. Thank you so much. Medication. The administration is pushing forward a cruel agenda, one that prioritizes billionaires while our patients struggle to afford their health care. This past Saturday, November 1st, was a devastating moment. Not only did our patients have to grapple with the reality that their health care coverage was no longer affordable, but additionally, 42 million people did not receive their SNAP benefits.
Shame.
As nurses, we understand the implications of this benefit cut. People will have to choose
Mike,
between
Mike.
paying their rent or utilities bills, buying groceries, or getting their prescriptions. When Trump and his congressional allies pushed forward their big budget bill back in July, nurses knew this was going to send an already fragile system into chaos. What happened on November 1st is only the beginning. The massive cuts to Medicaid and our social safety net programs are going to gut what little health care protections we have. Nurses will fight to restore these cruel cuts while we also fight for a better system. If there's one thing we've learned from this fascist regime, it's that we cannot go back. Not going back. The only pathway forward is to finally win a system that guarantees everyone the care they need, free at the point of service. People are ready to fight for a better system, a system built on the values of nurses, doctors, and providers who care for these patients. One like Medicare that puts patients over profits. For all, we would save this country trillions of dollars while also guaranteeing quality health care to every person living in the United States. Let's imagine what that would look like for our patients, for their families, and for the providers and nurses who care for them. Patients would never again ration their prescriptions or avoid going to their doctor so they don't go into debt. I work in the burn trauma ICU, so most of my patients don't expect to be in the hospital. Very few people expect to be in the hospital, but I took care of a guy a couple weeks ago who had a really bad inhalation injury, who was found down in a house fire. A gentleman was found down in a house fire with a bad inhalation injury, serious damage to his lungs from smoke inhalation. He was intubated and sedated. I was there when his brother saw him for the first time, and so I gave a 2-minute update with the resident at the bedside about the prognosis and the course of care, which is super, super serious. And his first question after, is he going to live, is, do you have a case manager, because I don't know about his insurance. So the fact that he saw we have a beautiful renovated unit. He saw the trappings of modern medicine, the best critical care. I was at the bedside, one nurse, one patient. All he could think about was the bill. That ain't right. That ain't right. Oh, let's place. This is not impossible. Our patients deserve to be treated with dignity, and they all deserve a better healthcare system.
That's right.
That's right. It feels hard in this moment to imagine a path forward when we're fighting for our most basic protections, but we can come together and put forward our vision for a better system. Let's fight for Medicare for all. Healthcare is a human right. We need Medicare for all now. Thank you.
Woo!
And I'll hand it over to my pediatric colleague.
One more time. What do we want?
Medicare for all!
Do we want it?
Now!
That's right. Okay. So next up we got Rachel Fox from SNAP and Akeem George from CIR SEIU. Come on up, y'all.
Let's go SNAP! Let's go CIR!
Good morning, everybody. I'm Dr. Akeem George. I'm a second-year resident pediatrician and proud union member of CIR SEIU.
And I'm Rachel Fox. for a national health program.
Woo!
We're standing here with you to let our representatives know that enough is enough.
Enough!
And that it's time to put patients over profit in our healthcare system.
Yeah. In my first years as a doctor, I've been a part of some of the most important moments in families' lives, seeing both beautiful moments like the embrace of a mom after a son was extubated, and tragic moments like the death of a child after a long fight with cancer. And increasingly, I've also had to sit in frustration with families as necessary medications are denied by insurance companies.
That's not right!
In medical school, we're taught to heal the whole person. But how can we heal the whole person when we are constantly stymied by prior authorizations and arbitrary claim denials?
That's not right.
That's not right. We're taught to consider the social, financial, and cultural aspects of our patient's health. But when a patient has a disease that's expensive to treat, how can we design a treatment plan knowing that it will likely cause them financial ruin? We're taught to establish rapport, build trust, and practice empathy for all of our patients. So then how can we watch the very same patients, our community members, be forced to choose between their medication and food? Right.
Making the choice to be present for someone else's suffering requires the kind of resolve that very few possess. And as physicians and caregivers, we choose to be with our patients through their struggles and the triumphs, committed to seeing them clearly through it all. That same resolve is what prepares us for the fight ahead. The fight for a better health system and a future where our patients no longer have to suffer from a broken system. Because when our healthcare is cut, our communities suffer.
That's right. We need to rise up and fight for a better system, one that we are proud to practice in. I didn't go to medical school to increase shareholder value for United Healthcare. I want to be a physician who heals the whole person, who promotes my patient's well-being, and who's a force for good in my community. I suspect that's why all of you went to medical school as well.
Yeah!
We've all taken the Hippocratic Oath, and that is why we're here today.
Healthcare is like a dance, but patients and doctors are the dancers, but neither of us controls the music or the choreography anymore. Money is shifted from a resource for patient care to the product of healthcare itself. And the only antidote to this corporate greed is solidarity. So let's move forward and demand an end to Medicaid cuts. An end to putting profits over patients, and demand that we need Medicare for all now. We need Medicare for all now so that the next generation of physicians can deliver on the promise of what we've been taught. We need Medicare for all now so that we can see all of our patients in high definition and give them the care that we all deserve. So Rachel, what do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
When do we want it?
Now!
The people, united!
We'll never be defeated!
The people,
United! We'll never be defeated!
the people!
United! We'll never be divided!
All right, y'all. For our last but definitely not least speaker, we've got Fari Gamina Tumpe from Popular Democracy and Spaces in Action right here from Washington, D.C.
What do we want?
Medicare for all!
What do we want it?
Now!
Then what do we want?
Medicare for all!
When do we want it?
Now!
If we don't get it,
Shut them down!
if we don't get it,
Shut it down!
if we don't get it, shut
it down.
If we don't get it,
Shut it down!
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 Again, I'm Fari Gamina Tumpe. I'm a social and economic justice activist here in D.C. Center for Popular Democracy and Spaces in Action D.C. I'm also a very proud native Washingtonian, born and raised right here on Capitol Hill, and I still live in the home where I was born. And I'm honored to carry on the history and heritage of my grandmother and mother, raising children in our community and feeding those that hunger. But now I too live with several autoimmune diseases, and I rely on SSI disability, Medicaid, and Medicare. I'm also a two-gen caregiver of 3 autistic grandchildren. And I have been for the past 16 years because their mother, my daughter, has schizophrenia. And that disease has been primarily treated in 3 ways for over 2 decades. Sedations, restraints, and seclusions.
No.
We have suffered many pitfalls with medication management from prior authorization requirements. It has been brutal and unbearable.
That ain't right.
And public health care as it stands is not comprehensive. And now our government intends to commit mass systemic murders. That's what it is. Reverend Dr. Martin Luther King Jr. once spoke of the civil rights movement and referred to it as the urgency of now. To have Congress restore health care and prevent looming Affordable Health Care Act premium spikes and the expiration of said act at the end of 2025 is the urgency of now.
Yes, it is.
Yeah.
Ending pro-billionaire dark money agendas to the tune of $1 trillion a year in tax breaks.
That ain't
The
right.
urgency is now.
It is now. Woo!
Woo!
There are only 800 billionaires in the United States of America, yet 340 million will suffer at the hands of Republicans in Congress. Let me hear you say shame!
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 People shouldn't be poor because they're sick,
That's right. Yeah.
or sick because they're poor.
That's right.
The power of the people is stronger than the people in power, and health care is a human right
Right.
and not a privilege. Let me hear you say health care is a human right.
Healthcare is a human right.
Health care is a human right.
Fight, fight, fight.
Health care is a human right.
Fight, fight, fight.
This administration has declared war against its own people. And it's time to end this dystopian nightmare where there is great suffering and injustice. Republicans, I invite you to close with a future-oriented question. What is the story you wish people will tell about you when you're gone? The story I hope people will tell about me is how I pushed people to be their best selves in spite of systemic oppression. Let us not forget that retribution is, was, and always will be solely in God's hands and in God's time. And if God chooses to make us wait a bit for that day of retribution, it is because he wants that day to taste that much sweeter. Together, Center for Popular Democracy, with national health, with physicians for national health programs, let's make America healthy again.
Woo!
Let me hear you say no more disparities.
No more disparities.